our relationship with our pain is a whole journey. It's multifaceted. That's why I told you I love this topic. But the Advil allows us to take a deep breath. It gives us a gap. What we do with this gap is a very big difference. Somebody can take the gap and try that now they want to try opiates and kind of put their life towards a trajectory to misery and end, Or somebody say, I got a gap. I'm going to call Dr. Whitten and see what he can do for me. And they use it as a gap.
Yeah.
Because now they can take a deep breath.
Yes.
And they can actually think clearly. Yes. So please, for people with pain, don't feel guilty or bad when you're taking anti-inflammatory. But if you take an anti-inflammatory and you take a pectasol, now you are starting to address pain in a very different level. And one of the things we see with galectin-3 blockers over time, and we didn't know it initially, is that pain is getting better. So the interest in galectin-3 was purely cancer in the early and mid-90s.
Okay.
It took a long time. Only now I presented our multi-center trial in biochemical relapse of prostate cancer in the big ASCO GU conference 2 weeks ago. And only now we demonstrated in larger studies 90% benefits after 18 months. Wow. In biochemical relapse of cancer. Wow. But when I developed modified citrus pectin, I was starting to give it to people, the most common feedback was my joint pains are getting better. My memory is better. My head is clearer. My blood pressure is improving, and what it was doing, that's when I realized, wow, it's attenuating inflammation. It was one of the discoveries. Yeah. Then we also realized, based on other things, wow, it's removing heavy metals. Modified citrus pectin is a powerful chelator of heavy metals, multiple published papers.
Yeah.
And so how did I discover it? After the Chernobyl incident, children had huge levels of radioactive materials in the area of Chernobyl, and they were given high molecular pectins because everything they ate had radioactive material.
So we're talking about the meltdown of the nuclear reactor in Chernobyl.
Exactly, yeah. And they saw levels going down by 50–60% so quickly.
As a result of taking modified citrus pectin?
No, of regular pectin, because it was in the digestion.
Now, in your book, you talk about how the absorption of regular pectin is nowhere near the modified.
Exactly. So it was just partially effective because it was only affecting the radioactive material in the food. Possibly some of it maybe was absorbed. And when you have a lot of radioactive material, it gets recycled through the bile, right? Sure. And so there's some benefits. That's why pectins and alginates are binders in the gut, right? Because of the recycling. And that's why I realized, wow, since I can modify it, it's going to be a systemic chelator. And I demonstrated it, reduction of lead, of mercury, cesium, uranium, actually demonstrated it. So heavy metals will also drive inflammation and pain, obviously.
Sure.
So that's another factor why it's so important.
Yeah, let's talk about that in a second, but I want to go back to something you said a minute ago because it was very sophisticated and you went through it quickly, and I want to make sure that people hear what you said. You said, I'm going to paraphrase a little bit, that if you use the gap that you called it, I always call it buying time. If you buy some time by diminishing your symptoms, it'll allow you to think clearly and make better decisions. And then you can work on actually solving the problem. So that's one of the things that I'm constantly trying to get through to people is that the pain is not the problem. The pain is letting you know that there is a problem.
Exactly.
So if we can use those drugs, and the way that you phrased it was just perfect. It was extremely sophisticated, and it's uncommon for a medical doctor to phrase it the way that you did. But you were very careful about how you said it. You used it as a gap to decrease the pain so that you can focus on the problem. The other half of what you said was, if you use that alleviation, and I got the image in my head of like somebody taking a hit and like enjoying it, and then you say, oh, okay, now I want to go on to the opioids. And you basically said that that is the path to disaster. So it was like this crossroads that you framed of using the same substance to create this gap, and then you can go this way or you can go this way, and they lead to very different places.
If you enjoyed that short clip, you've got to see the full interview with Dr. Isaac Elias, where we do a deep dive on the subject of inflammation and the best ways to combat it. To watch that video, click the link in the upper right-hand corner of your screen now. Thank you so much for watching. See you next time.